A recent Gallup poll suggests that the majority of adults in the United States support the idea of a federally funded single-payer healthcare system. Presented with different scenarios, it appears that even Republicans who wish to repeal the Affordable Care Act largely favor replacing it with a more liberal system, something Bernie Sanders calls Medicare for all. So this was a series of telephone interviews that was conducted from May 6th to May 8th. They sampled about 1,500 adults through all United States through all states here, and there were 60% cell phones, 40% landlines, just to get a nice little sample size there. So these people were presented with three different scenarios of how the Affordable Care Act could continue. They did based on candidates' proposals. They did not name the candidates by name, though, just to avoid any of that kind of political narrative getting in there. So 50%, according to this this series of polls, 50% of United States adults do favor a federally funded healthcare system. That's, of course, Bernie Sanders' primary point, is the idea of Medicare for all. 48% favor keeping the Affordable Care Act, Obamacare. That is something that Hillary Clinton has been supportive of. And then there's a slight majority, 51%, that just want to repeal the Affordable Care Act altogether, which is, of course, Donald Trump's idea. From there, it wasn't. So as I said, they asked these questions separately, and then, of course, would follow up by saying, would you want to replace it with something else? And that's where the numbers get a little bit different. But just based off that, right off the bat, what do you think?
Yeah, I think the questioning seems so broad that it doesn't really lead you to any sensible conclusion. It's difficult to draw a really sensible, defined conclusion from it. I think the fact of the matter is that the healthcare system in this country is not working, or it's broken. As good as the healthcare coverage is, or as good as the specialized care that you can get in this country, and it's advanced as the technology that they use is, it can cost you an arm and a leg, and it can be, for a lot of Americans, is not affordable. And so as a consequence, their healthcare is suffering. So I think there's no secret that that's the case, and I think it's no secret that people are looking at alternatives. But to say then, well, you would repeal Obamacare, okay, the Affordable Care Act, okay, fine. And what would you replace it with? It doesn't really, it's just a soundbite rather than a policy or something that's thought through. And again, I hate to come back to it, but I think the same could be said of, as admirable as Bernie Sanders' approach is, it's almost as though the genie's out of the bottle with regards to the insurance companies and the way that we've set it up here in terms of actually working it back to a single payer system that he's advocated. And I'm from the UK, which is the home of the NHS, so I'm right behind that. But listen, the NHS has a lot of problems itself, and people who analyze and study it and know about it are arguing that in 50 years' time, the NHS will no longer exist just because it becomes too expensive, it's unworkable. And for all of the reasons that America's in the situation that it's in. So I just want to throw that slightly cautionary note out there that it's not this kind of utopia that people cling to. It comes with a whole slew of problems.
Well, I mean, I think to your point, certainly in terms of it, maybe the questions being a little bit broad. Yes, of course, they used kind of like shorthanded ways of asking people just to get a general idea. It's clear that a lot of people don't know enough about a single payer program to really make that decision. So they at least acknowledge that with this polling. But I think, to me, the reason why this is compelling is because we've had this narrative for so long of the idea of like socialized medicine in America never working, single payer never being something that exists here, that's something that people would support. And I think at least this information shows us that when you strip away some of the names, when you strip away the Republican and the Democrat kind of narrative from the argument, you see that people ultimately, we're not satisfied. We're not satisfied with the way healthcare is run in this country. The Affordable Care Act has a lot of its issues. I mean, of course, some people support the fact that there are many more Americans that are insured than were before. Right. At the same time, it's clearly, for many people, it didn't go far enough. So I think one of the most compelling figures I found was also that 41% of Republicans support repealing Obamacare and then replacing it with single payer. So that's not the kind of rhetoric that we generally hear. Certainly from the right side of the aisle, we usually hear more of that socialized medicine being bad, or the idea of a single payer being terrible. So I think that's what I found the most interesting thing about this. Now, of course, the argument could be, well, anything would be better than Obamacare. It's been so demonized over the past few years. But I mean, definitely, I acknowledge your point of, some people they're still not particularly educated on how Bernie Sanders would support paying for this. I mean, although he has laid out a lot of his policies, a lot of it has to do with, closing some of these crazy tax loopholes that wealthy Americans are able to get away with. But of course, that just, that leads to even bigger arguments. But I at least found this very compelling, that maybe people are more supportive of something that is socialized than I would have ever thought before.
Yeah, I guess if you the point being, I think if you strip it of the word social, and if you don't call it socialized, you just call it single payer, which obviously the Sanders campaign has been keen to do, then it perhaps de-demonizes it in people's minds, because obviously a lot of people would have a very strong reaction to the word socialized.
Right.
So if you just have it as a single payer system that ultimately would have to be federally funded, that would have to be, I just in terms of the overhaul, and again, it comes back to it, I don't know how specific these questions were, but in terms of the overhaul, it's just going to be so problematic to do. No one's going to cry a single tear over insurance companies falling away overnight. But the impact is that hospital administrative costs would have to be dramatically slashed, doctors' pays would have to be dramatically altered. There will be a whole extensive slew of repercussions.
Right.
That occur in other countries which are looked at as the model for a single payer system, such as France, such as the UK, for better or for worse. And those are the type of impacts, and those are the type of cuts or economics that operate in those systems. Yeah, I think what this tells me is that people are fundamentally unhappy with the way that the healthcare system is set up, and they want it changed.
Right, absolutely. And I think, as with most polling, it just gives you a glimpse into what people think. Of course, it's not like they polled everybody in America. They polled 1,500 people, so that at least gives you a slice of what the American public thinks. Again, yes, putting these things into practice, that would be one of the biggest overhauls of a system in the United States if they were to do single payer. So clearly it's much more complicated, but at least from this most recent Gallup poll, it would appear that Medicare for all is perhaps more popular than we thought.